LEX18 recently shined a light on the shortage of specially trained nurses who give in-depth exams to rape victims. They're widely known as SANEs.
Only a fraction of Kentucky hospitals have them on a full-time basis, and a lawmaker just filed legislation hoping to give victims better access.
Lee Searcy has more in this LEX18 Investigates.
No one ever expects to be raped or sexually assaulted, but when it happens, prosecutors and victims advocates say SANEs are the best trained and qualified nurses to collect vital evidence. The so-called medical detectives give in-depth forensic medical exams and provide strong emotional support. Rape victim Hillary Sykes didn't know about SANEs after her attack, but now pushes for more of them.
You're going through something so hard, it needs to be given the full attention that it deserves. It's evidence of a crime. It's against the law to turn people away. You know, there's more that can be done.
Even though Kentucky law requires hospitals with emergency rooms to conduct sexual assault forensic exams, most Kentucky hospitals don't have full-time SANEs. SANE trainers say some victims wait hours for care if they see a SANE at all. Representative Sherilyn Stevenson wants that to change.
We've even heard reports that women are being turned away or they're being sent somewhere else. And, you know, for me, that's very unacceptable.
Since our last story, more hospitals are now SANE-ready. According to the Cabinet for Health and Family Services, of Kentucky's 78 hospitals with ERs, there are now 11 SANE-ready hospitals. Take a look. Here they are with their locations. Stevenson says this is not enough.
You know, I think it's just crazy. Like every one of them should be SANE-ready.
The representative from Lexington is one of several lawmakers trying to make that happen. She sponsored a bill to require hospitals with emergency services to have SANE nurses on duty around the clock. She knows that's ambitious, and the bill hasn't even made it out of committee, but she's hoping it gets traction, along with a resolution making hospitals, the Kentucky Board of Nursing, and other relevant organizations report how many sexual assault cases they see each year. So far, getting that number hasn't been easy. Many hospitals cite HIPAA rules, but Stevenson says the focus is on the raw numbers, not patients' names or personal details.
We need public pressure to be able to move on this. So, you know, we need pressure put on legislators to take action on this, and we need pressure put on hospitals to provide this service.
Stevenson says her main goal is access for victims and believes so-called satellite SANEs spread across the state could be a solution by responding to cases within an hour or so. She points out SANE nurses generally work double duty, but are credentialed to step in if needed.
So we have got to find a way to turn this around. We've got to find a way to be taking care of these people. Again, it's men, women, and children, and when this happens to them, we've got to give them every chance that we can at physical recovery and a chance for justice.
Stevenson says more SANEs will make that happen. Lee Searcy, LEX18 News.